so the equipment we're using is an IMED pump, a bag of saline, IV line giving set, medication, swabs, needle and syringe, sharps container, MIMS or equivalent, our label, gloves, kidney dish, and we've all washed our hands before we... Both nurses have checked dose, expiry of medication, the medication chart and MIMS. Sonya is drawing up the medication while Elyse is writing the label. The label has to have written medication dose, the fluid that is used, and be signed by 2 nurses. The dosage being drawn up is 25,000 units in 500 ml normal saline, making 50 units per ml. So they're just checking the medication, getting rid of the sharps. Sonya's just replaced the needle with a 19 gauge sterile needle while she injects it into the bag. Okay, so once the medication's been injected to the bag, they will then label it and both sign the sticker. So we now have our medication in our bag and all labelled, ready to go.
Maddie is puncturing the bag and priming the line, making sure that there is no air in it before she puts it into the IMED pump and connects it to the patient. Maddie has checked the 5 rights with the patient. Okay. Maddie's now primed the line and she's just connecting it to the patient, making sure she cleans the cannula before she puts it on. Maddie's now putting the line through the IMED pump.
Elyse is setting the correct rate and volume on the pump as per our calculations for both the bolus dose and the infusion rate. The rate and volume is 16 mils per hour and the bolus is 100 mils.
Documentation should always be checked by 2 nurses to ensure that the medication is ordered correctly and is a safe dose for the weight of the patient. It is important to follow the injectable guidelines book in ensuring the medication is given with a compatible fluid. Patient history should be viewed before administration to determine if they are on any other medications or have any allergies. All of the actions performed should be double-checked and signed by another registered nurse to eliminate mistakes. The drawing up of heparin would usually be done in a drug room and not at the bedside. Infusion pump as well as the site of the cannula should be checked hourly by the registered nurse. The APTT levels need to be assessed 4 to 6 hours after drug administration to ensure that levels are within a therapeutic range. Due to the university resources, we were unable to have unopened sterile IV giving set, saline bag and other sterile equipment. All of the sharps were disposed in appropriate sharps container.